Um, Please do keep your mics off for the moment. What we'll do is we'll turn the mics back on at the end of this recording, and then we'll go through a Q&A. And obviously, I'll stop the recording before we start the Q&A. But again, thank you very much for joining us this morning. Um, what I'm going to do is over the next few minutes, I'm going to just give a bit of an overview. So in terms of an overview, I'm going to give a bit of a recap on the NICE guidelines and what we discussed in the last webinar. I'm going to go over a bit of information about when burosumab is potentially going to be available, who it's going to be available to, how it's going to be available, and how you might get it, and also, what's happening now between now and that point of being able to start treatment. And then, of course, just finally, ways in which you can help us and help what we're working towards. So just a recap on the NICE guidance. Obviously, NICE recommendation is first of all available to all adults in England. And what also happens in that same decision is that NHS Wales and also Northern Ireland will also adopt the same recommendation from NICE. As many of you probably already know, burosumab is already available to adults in Scotland. So what that now means is that there will be universal healthcare access to burosumab across the country, which is brilliant. It's going to be available to all adults and all adults with a genetic test for XLH. So that is a key part of this. And it's also going to be available on the NHS. So again, brilliant news in terms of being able to access treatment. Um, um, when are you going to be able to get it? Who's it going to be available to, and how are you going to be able to get it? I guess first of all, I just need to probably mention that more importantly, burosumab can only be prescribed by a specialist in metabolic bone. So that's typically a rheumatologist or an endocrinologist. And if you're not already seeing one of those specialists typically at a university hospital, it's important that you get back in touch with your GP, speak to them about your XLH, and get them to try and make a referral to a specialist in metabolic bone. If you're unclear about, who, I mean, a GP should be able to establish and make a recommendation. But if you're unclear or there's different options available to you, feel free to have a look on our website because we have a sort of a map of specialists that you can sort of see and maybe work out which you're closest to. But if again you find it's a bit of a difficult question to answer, feel free to drop us a note um, in a chat or over probably email is probably best actually to us, which is obviously contact@xlhuk.org. In terms of what happens next, once you meet your specialist, they will obviously need to obtain a proper diagnosis of XLH. It may feel a bit counterproductive because you may already have a really good relationship with that specialist, but if they don't have that genetic diagnosis, they can't actually prescribe. So that's really important that they go through that step as well. So just kind of setting expectations, that could be a bit of a long process because obviously a clinician will invite you back into the hospital. They'll draw a little bit of blood. Those get sent off to the labs, and that's where they're able to do and identify the FEX mutation for XLH. Um, Quite often, the actual types of tests that are used are not on site, and so they're sent to specific locations. I think there's like a main genetics labs in Leeds or something. So, again, all of that takes time and time to get the results back, etc. So just kind of setting expectations there. What typically also happens is that at hospital level, there will be a sort of a logistics um, process they need to go through as well in terms of arranging home care delivery because once you start burosumab, the initial injection is likely to be in hospital by the clinical nursing team there, but afterwards there's this sort of home care package that needs to be arranged with you. So um, the home care team will call you and they'll arrange the best times for delivery, etc. So all of that needs to be taken into account as well, and that obviously takes time to set up. So just moving on again, what also happens in that home care team package, there is a point where a nursing team will help train you in being able to administer burosumab yourself. So that, that can typically start in hospital, but it can also continue in the home for a couple of months. But again, those specifics will be down to the specific care team that's available to you at your hospital. And finally, hopefully you'll be then at a point where you can self-administer and it's nice and easy. So yeah, I think hopefully that answers your questions on when, who, and how. So just moving on to, what's actually happening right now. I mentioned that NICE have created guidance. Sorry, NICE have created guidelines. Those guidelines are obviously they determine the cost effectiveness of a medicine and thus them recommending burosumab. What's happening right now is that NICE are working on what they're calling their final guidance, and that's different from the final draft guidance that was published a month ago. In that this sort of period that we're in now is technically like a challenge period. So technically, other companies or members of the public could challenge the decision that's just been made. And so that's why there's this sort of period of time before the final guidance for guidelines are created. So we're expecting them to be published on the NICE website again on in the probably by the second week of August. And that's when the sort of 90 days starts in which the clinical teams around the country need to get ready in terms of being able to start to prescribe burosumab. It's important that a lot of clinicians won't actually start that process or start the prescription before November 8th or 9th. And that's purely because they would end up paying full price for the medicine as opposed to sort of the new commercial agreement that NHS England have created with the pharmaceutical company. Um, so obviously they're just kind of setting expectation again. It's likely, for those that have not been on treatment before, it's likely that that's not going to start until sort of the second week of November. And that's at the earliest as well. What's also happening now is there's a new sort of process document that's being created, and this is called the XLH guidelines on using burosumab in adults. It's different to the guidance that NICE are creating. I'm sorry that the terminology is so similar. I get confused and I interchange them all the time. But they are different, and I'm going to explain a little bit more about the the um, uh, the guidelines that the clinicians are going to be creating in just a moment. So the other aspect, the other sort of process that's sort of going on right now is that um, pharmacology units around the country will be getting ready to prescribe burosumab. There's lots of sort of forms and processes that they need to complete. And again, that differs between hospitals and areas of the country. So that's something that all of the clinicians at the moment are working with their pharmacy teams to anticipate this new demand in November. Um, I've said about home care as well and the importance of arranging the logistics of home care services. Again, in hospitals where they're not already prescribing burosumab, that's going to be something new or something that they're going to have to adapt to basically extend whatever home care arrangements they have with delivering other medicines and being able to take on burosumab as well. I should probably also note that also um, clinicians have also been working with the genetics teams up in Leeds where they're doing the actual diagnosing. So they're sort of giving them a heads up that there's potentially going to be an influx in people trying to get an XLH diagnosis or looking for that XLH diagnosis. So just keep in mind that there's lots of things going on in the background there. So as I said, I was going to talk a little bit more about the NHS guidelines on burosumab in adults. So this is a really good document and an important document and something that is currently being written by a core clinical writing team, and um, the reason why it differs from the guidance that NICE have created, as I said, NICE have created this guidance on cost effectiveness. These guidelines are about the processes and the steps that clinicians will follow. So, for instance, so the aim of the actual document itself is to develop recommendations that support equitable and effective and efficient initiation and monitoring of burosumab for adults with XLH. It's a bit of a mouthful, but it's really important that there is this consensus among the clinical care teams all over the country. And what's really fantastic is we've now met with the clinical teams on several occasions now, and there is a great appetite to get this document ready and finished by November 8th. And everybody really appreciates that a lot of time is being sort of devoted into creating this document from the core clinical writing team. So big kudos to them for putting that together on top of their current workload. So that's great. Um, they're also going to be looking to essentially get endorsement from professional societies. So these are just some examples. It doesn't necessarily mean that it's going to be with these, but that's what they're working with at the moment. And in addition to that, they will then be publishing via the Rare Disease Collaborative Network, which is a NHS funded group. And again, really important and is a great move for the Rare Disease Collaborative Network. So how can you help? I sound like a bit of an old record, but the Rudy study is so, so important. Even today, post NICE guidance, if you're not already on the Rudy study, it's really important that you sign up. If you're already on the Rudy study, please log back in and just check if you've got any outstanding surveys that need to be completed. This is going to be key in sort of building out the XLH patient registry, and it's going to be key in determining, what universal access to burosumab in the adult population can do, and that's something that is incredibly unique and unique to this country and the benefit of being within the NHS. So um, please do go into that. If there's any other questions that you have, obviously we have the xlhuk.org website available. We have a large sort of roster of FAQs available. There's also links to the research study, which is the Rudy study on our website as well. I believe I've now finished. Sarah, please jump in
Yeah,
if I've missed anything or anything you want me to answer at this point. Otherwise, I'll stop recording.
thank you, Oliver. The one thing I wanted to mention is I actually wanted to publicly thank you for all of the work that you are doing. You rather modestly didn't include that you are a key member of the team that is writing the guidelines, and also that XLH UK is using some of our funds to help with that process. So thank you very much for all your work on this. It's amazing.
You're welcome. Yeah. No, and thank you to everybody else as well that's helped support the charity over the years. Because it's, without the generosity of the public, we wouldn't be able to work on projects such as these.